An aneurysm is an outpouching of the blood vessels in the brain. In some instances, that can lead to the aneurysm bursting, and that's the ultimate consequence. A lot of people find out they have aneurysms in pretty much one of two ways. Either some other issue is going on, and they get imaging of the blood vessels in the brain and find out they have an aneurysm, or obviously you want to avoid having an aneurysm burst and finding out that way. The good news is aneurysms are common. The rupture of aneurysms is not very common. They say about 1 in 50 people have aneurysms and don't know about them. In the United States, only about 30,000 of those burst per year. Our goal is to figure out the ones who are potentially at risk for bursting and intervene on those before they have a chance to. The way aneurysms are typically found are with imaging such as MRIs or CAT scans and sometimes angiograms for other reasons. Broadly speaking, there are a couple of things you could do to fix aneurysms. One is observation. In certain situations it is appropriate, but in situations where we figure treatment is indicated, there are two main ways of fixing aneurysms. One is with open surgery, where you make a craniotomy and dissect down to the aneurysm and place a clip on it. The other is endovascular treatment, a more minimally invasive way of treating aneurysms. The worst thing that can happen typically with an aneurysm is that the aneurysm can burst. The problem with that is it's a very deadly process to happen. About a quarter of people don't make it to the hospital when the aneurysm bursts, and of those people who do make it, the vast majority are disabled when they leave the hospital despite our best treatments. So it's paramount that when you find out you have an aneurysm, you get to a specialist and find an appropriate treatment plan for you. So we at Tulane Neurosciences have several specialists who are experts in treating aneurysms, whether that be with open surgery or with endovascular treatment. So please, if you have any elective aneurysms, come see us.